This is the sound of refusing to give in. It's leaving nothing to chance. Searching relentlessly for the right, the only treatment option that will keep a heart beating. Fortunately, the Christ Hospital Health Network has groundbreaking treatment options unavailable anywhere else in the country, developed with help from our own physicians. That's what makes us Greater Cincinnati's Heart Hospital and one of the top heart hospitals in the world. The Christ Hospital Health Network, everything it takes.
The Pound This Podcast is brought to you by the Christ Hospital Health Network. This is the Pound This Podcast, episode 794, The Impacts of Nicotine on Spine Health with Dr. Jared Crasto.
I want to lose weight, but I don't know how to get started.
What should I meal prep every week?
How do I get those sweet booty gains?
Inspiration for your healthy lifestyle. The Pound This Podcast with Amanda Valentine.
Hello, friends. Welcome to the Pound This Podcast. Before we get into this fantastic conversation with Dr. Crasto about spine health and nicotine, which is very interesting, I want to tell you about some amazing resources that you can use on your health and wellness journey. One being Sarah and Team Fit With Me. Sarah is a fantastic health coach, has a whole team behind her. Sarah and I have a very long history together, including being my own health coach. I will say, Laz, this was inflammation, but in the past week, you guys, it's been 1,000 years this has happened for me. I was down almost 7 freaking pounds. Ooh. And that is with the guidance of Sarah and Team Fit With Me. So if you need somebody who's going to help you with nutrition, help you with accountability, help you with physical fitness, all of the above, no matter what your goals are, Sarah can help you out. Save 10% off of month 1 of all packages and plans when you go to teamfitwithme.com/poundthis. So that has been super helpful as I'm getting back on the health and wellness train here. And then also Clean Eats coming in clutch. I've been a meal prepper for a decade, and so it's been very nice for me to not spend Sundays cooking all day and to let Clean Eats do the cooking for me. They show all of the calories and macros in every single meal. I do the fresh meals. You can do whatever you want. You can go and grab and go with the frozen meals. You can go in and eat at the cafe, or you can do the fresh meals. You can choose different options. I personally choose 21 meals a week because I want it to be as simple as possible. Lots of variety. The food's delicious. It changes every week. And again, right on the package, macros, calories, and I can log that all in my Fitness Pal and track what I'm doing. It's fantastic. So if you're here in Cincinnati, where I am, I go to Clean Eats in Newport. There's also Clean Eats in Westchester, Ohio. And if you're not in Cincinnati, you can look and see if there's a Clean Eats location close to you, because it's great convenience, delicious, and fresh foods. It's amazing. So check all of those things out. And right now, let's check out Dr. Crasto. Thank you so much for listening to the Pound This Podcast. I am Amanda Valentine, excited for my guest today from the Christ Hospital Health Network, Dr. Jared Crasto. How are you?
Hi, I'm great. How are you?
Great. So you're an orthopedic surgeon at Christ, correct?
Yes.
And I know we're here to talk about Lung Cancer Awareness Month. And specifically, this is a topic I have never even thought about before, the effects of nicotine on spine health, which we're going to get into here in a minute. But before we get into that topic, let's talk all about you. So what made you interested in orthopedics? How did you, go to become a doctor in that area? And how did you end up at Christ Hospital?
Yeah, absolutely. Going into medical school, I knew that I liked working with musculoskeletal problems, and I really enjoyed using my hands to perform surgery and help get people better. So orthopedics kind of spoke to me when I was on rotations, and I was happy to match at an orthopedic surgery residency in Pittsburgh, and that's where I did my training.
Now, are you originally from Cincinnati?
I'm from Dayton area, not too far away.
Okay. And then it just kind of made sense to come back to Ohio and work at Christ Hospital.
Yes, my wife and I wanted to be back closer to home, and we found a great job at Christ Hospital.
Awesome. You had to be closer to Skyline.
Exactly.
So tell me, I know there's research on this, and I find this so interesting. I guess in general, we're, just kind of mean that this is not anything that I'm up on. I've never been a smoker, although I will say at my first full-time job, my boss forced me to smoke because he thought I sounded too young. Isn't that fun? I don't think you could get away with that now. But no. Other than that, I know that smoking is bad for you, and obviously lung cancer, but I never really thought about nicotine and smoking and how that would affect your spine. So like, tell me what the research is showing on that.
Absolutely. So, nicotine does a few things to your body in general, and then we'll talk about kind of how that works in your spine. So, nicotine impairs blood flow to areas that really don't have a lot to begin with. It does this by kind of clamping down the blood vessels. It changes the artery walls. It impairs your body's ability to break down small clots that happen normally, and it changes how the blood flows. So, when you have spaces like the intervertebral disc space where there's not a lot of blood flow to begin with, any injury or anything like that is much harder to recover from because the nicotine impairs that blood flow.
So how would that, I mean, do you have to be a regular smoker for that to happen? Or what about like in a case like mine, when I was 20 years old and my boss is forcing me to smoke outside with him? Like, is that something that's going to kind of stick with me forever?
So there's definitely a ramp up period and then kind of a cool off period. So it has to be typically a regular amount that you're smoking. And then after a certain period of time that is based on how long you were smoking, the effects can become reversible.
Interesting. So how much does that play into, like, I have an achy back, I have back problems, and how much is that linked to nicotine use?
Yeah, so part of it is that people who get normal injuries that anyone would get during a typical day or working or anything like that, people who are smoking have less of an ability to naturally repair those injuries on their own with their body's normal mechanisms.
Mm. So is there a difference between the nicotine that you use versus like smoking a Camel or chewing tobacco or vaping, or is it all equal playing field?
So what I'm concerned mostly with is the nicotine content. So there are all sorts of non-cigarette alternatives, including vaping and things like that. But in terms of the pain and the inability to repair, that's the nicotine specifically. So even when people are quitting patches, gum, all of that unfortunately still plays into that. However, obviously smoking in Camel, cigarette smoke that has all the other tar and carcinogens, that plays into your overall health more so.
And do you see a lot? I mean, obviously, this is your area of expertise, and that you're working on people's bodies and doing surgery. In 2022, are there still like a significant amount of smokers? Because it feels like obviously you can't smoke unless you're in Kentucky. You can't smoke indoors, or it just feels like that's not the normal like it used to be. So, do you still see that? Is that pretty prevalent within the population?
It is. I think it's regional, and I tend to see patients who are a little bit older in general. Those are patients who have degenerative conditions that are considering surgery. I think in the younger generation, it's much less common. But for example, I did my fellowship training in spine surgery in Scottsdale, Arizona, and in that region, it's actually quite uncommon for people to be smoking. At least the people that I saw in my office. So out of let's say 30 patients that I saw in a day there, maybe one or two were smokers. That same proportion here is probably closer to 5 or 10.
Okay. Yeah, I guess I'd see in my general bubble of a world, I guess I don't see a ton of cigarette smokers, but I see more people vaping, and that's why I was kind of curious the health effects of vaping versus cigarettes, or I guess cigars or anything like that, because again, like I have very little knowledge on that, but for the things that I have heard are that like vaping is like worse for you. You're inhaling more bad things or something like that. I don't know. Like, you tell me.
Yeah, I think that what it does is it isolates that most addictive part of the cigarettes, the nicotine. Nicotine's one of the most addictive drugs, and then it just gives you that, and you're putting that straight into your body, and it's very, very hard to kind of break that addiction.
So I did have somebody that had some questions to ask you, and I wanted to ask you these directly from someone else that was very interested in this topic. They said, would someone with a history of smoking for several years during their young adulthood still be at higher risk for spinal issues decades later as they enter middle age, and would resistance training help offset any risks?
That's a great question. So in that scenario, if you had quit smoking kind of decades ago, then at that point, you've done everything that you can to make all the reversible effects reversed. Excuse me. So at that point, I do think that, there might have been some ongoing kind of damage to the lungs that had happened, but improving your lung capacity through regular aerobic exercise, or resistance training, and a combination of those two things, in part with a healthy lifestyle, I think is the best thing they can do moving forward.
Okay. So would that kind of go for, like, even if you are, like, let's say, just to throw a scenario out there, you are a current smoker or nicotine user, are you offsetting any of those risks at all by doing any sort of like exercise strength training? Or is it just like, no, that's too bad and there's nothing you can do that's going to offset that?
There's things you can do to keep your lungs healthier while you're smoking, and definitely aerobic exercise is one of those. But unfortunately, the detriment of current smoking almost outweighs that. Now, if you were smoking and you were also doing nothing, that's definitely worse. But the smoking itself is very bad.
So what are the things that we know that for, talking about lung health and spinal health, and obviously nicotine is bad news bears, but like what kind of things can we do that fuel that? I mean, are there any like anything nutritionally that we can do that kind of builds up spine health, especially if anybody is listening to this and they haven't been a smoker, but they're like, hey, I also don't want to have the backaches and, have, osteoporosis and all of those fun things happen with my bones. Like what kind of things can we do to actively kind of hold that off?
Yeah. So osteoporosis you bring up is a good point. Things that we can do to improve our chances of not having osteoporosis or having less disability from it is regular resistance training to strengthen your bones. So kind of weighted, lunges, squats, things like that. Other things are dietary, calcium, vitamin D regularly. It tends to be that needs to be kind of from a younger age. So when you're older, it's less effect, but it's still important. And then, in terms of other things nutritionally, we found that, a lot more research is being done on smoking and other things in general on increasing inflammation in our bodies. So as much as we can decrease that through diet, through antioxidants, through natural and anti-inflammatory diets, such as like a Mediterranean diet, things like that. So if people want to try absolutely everything they can, then those are the kinds of things I tell them to try.
And it's just so hard because like culturally our diets here in the United States are very inflammatory.
Yes.
I mean, I have an autoimmune disease, and so I'm supposed to stay pretty anti-inflammatory, and it is extremely difficult. So it's one of those hard things of like trying to stay away from dairy and gluten and all of that. And it does make a difference. And I can personally feel a difference in my joints and everything else when I eat that way. But it's also not very conducive to like having a social life.
Yes, absolutely.
So I think it's one of those things that, you have to kind of rate your importance of, do you want your body to ache or currently and when you're older? And then also just I wanted to touch on too and ask you about, it's a little bit off topic from nicotine, but from being a personal trainer in the past and working with an older population, it's my understanding that strength training is the best thing you could do for your bone health and just health in general. And it feels like an older population kind of like shies away from lifting up any sort of weights. And I guess what your thought process on that is of the level of importance and how often and how to actually work that into a lifestyle when you're an active older adult.
Yes, absolutely. What happens as we age is that our muscle mass overall tends to drop, and it's more difficult for us to build up that muscle mass, and it's easier for it to go away immediately. So all of those things mean that actually patients, to do healthy, active aging, need to maintain resistance training. Now, it doesn't need to be that they're throwing up hundreds of pounds on a bench press or anything like that. A lot of it can be body weight or light weights at just higher reps, but resistance training is very important because it's much easier to maintain muscle mass than it is to regain it once it goes, and it goes very quickly, unfortunately, as we age.
Yeah. And so what kind of health benefits is that actually giving you?
So the resistance training itself, so maintaining higher muscle mass will maintain their basal metabolic rate at a higher rate. So they'll kind of maintain healthier weight easier. It also has effects on strengthening their bones. So it improves patients who have osteoporosis if they're doing resistance training, because those muscles are pulling across the bones when you're doing your exercise, and they're stressing the bone, which helps it to metabolize more and kind of increase its strength.
So whenever you're performing surgery, and you obviously see a lot of patients, can you just tell by the body whether or not somebody is doing some strength training or just moving around actively versus not?
Absolutely. Yeah. I mean, so I operate on, as an orthopedic surgeon, we're taking care of bones, muscles, joints, tendons, ligaments, things like that. I specifically specialize in spine surgery. And so, I examine as I'm doing the surgery, the content of their muscle. I understand their bone quality. So it's very easy for me to tell during surgery, patients who are very active and patients who are not.
And I'm assuming you can also, I mean, I would imagine before you get to a surgery standpoint, they're going to let you know if they're a smoker or not. But like, can you just see within the body too? You can just automatically tell visually that they're a smoker versus they're not.
I can. A lot of this stuff is visual. So again, certain areas in the skin don't get, very much blood flow and require that microvascular circulation. So lots of people can tell someone who's chronically been smoking even by kind of the sound of their voice, like you had alluded to with your boss, or their skin tones or their skin moisture in their face, things like that.
Well, and we talked about having like back issues too. And I know like just even neck issues. I mean, obviously still your spine. Do you see a lot of people are just like, oh, it must just be like sitting all day. You're looking at my computer or my phone when really it's something like they're smoking and that's impairing their neck?
Yeah, I mean, I think that, there's lots of micro injuries throughout the day that happen. You'll kind of tweak your neck funny, and then you have to hold it in a position, or you get pain in the back of your neck or your back. And those are all kind of micro injuries that your body naturally addresses and heals. And they just has less than an ability to do that. So it could be that, yeah, they think it's something, and their smoking is really worsening it.
Yeah. Well, I mean, especially like, speaking from myself as I'm getting older, it's like one of those things of like, oh, I just like sneezed wrong and now I hurt. I'm like, oh, why am I so old? But I imagine, doing things like not smoking, have a healthy diet, being active kind of like lessens those things. I mean, is there any sort of keeping those things away, or is that just a general fact of aging, is that stuff is just going to pop up inevitably and you can only kind of lessen the effects through your lifestyle choices?
Correct. Yeah. I mean, I think you hit the nail on the head. The easiest thing is the thing that everybody knows but doesn't want to do. It's diet, it's exercise, it's getting into a routine, and just leading a healthy lifestyle.
And so, do you have anything? I don't know if you know the answer to this or not, since we're talking about smoking, and obviously, I think that smokers even know like smoking isn't the best for them, and maybe they want to quit, and it's really hard because it's hard to quit anything especially that's addictive. Like, does Christ Hospital offer anything? Like, if they came to see you and they're having issues, is there like any sort of programs or help to like help people stop smoking?
Absolutely. So we have a strong network of primary care physicians that I lean on a lot for this. And there's a number of things. So we kind of alluded a little bit to the patches and gum that people had historically used. There's two different medications on the market. One is called Chantix or varenicline that's been around for a while. Another is called Wellbutrin or bupropion. And these are different medications that have shown efficacy in clinical studies to help people be able to stop smoking. There's all sorts of programs, there's therapy, there's hypnosis even. So there's a lot of different ways that people can attack their journey of stopping to smoke.
Yeah, because it's one of those things speaking as like a binge eater and having addictions in my own ways, of doing it alone is pretty brutal. And I feel like things like that, it's like automatically you feel like you have to do it alone. Like this was your problem. You created this, you have to end it. And I feel like that's just like not really going to be helpful when there's so many people that are willing to help in so many programs that, there's no shame in asking for help and using some of those tools, because that's what they're there for.
Yeah, absolutely.
So if somebody is listening to this, I mean, do people like actively ask questions to you? If somebody has any questions, do they go to their primary care? Are you just kind of the last resort when something's wrong? I got it. And then now I see Dr. Crasto.
I tend to be more of the last resort. Patients typically will see their primary care physicians first. And if they have issues, beyond that, then the primary care doctors reach out to me. But I'm happy to take questions anytime.
What's the best way to reach you? Just go to the Christ Hospital's website?
Exactly. Yeah. On the Christ Hospital website, they can navigate to my page. They just type in my name, and you can send my chart messages or call my office and even set up appointments through there.
Awesome. Well, thank you so much for your time. This was super informative, and hopefully maybe we changed a life and changed the perspective of a smoker today.
Yeah, absolutely. Thank you so much for having me.
AmandaValentineBites.com